So much for being with us here for the Daily Town Hall at 5:30. I'm Kate Welshofer.
And I'm Michael Wooten. It's nice to be with you. Today is the day that the mask mandate returned to the entire state of New York as of this morning. That means you are now required to wear a face covering at all indoor public spaces, whether or not you're vaccinated. There is just one exception.
If a business or a venue decides to require proof of vaccination so that everyone has gotten the shot, then you do not need to wear a mask at that sort of location. This new state mandate from Governor Kathy Hochul is similar to what Erie County instituted a few weeks ago. Now it just applies to all counties. And joining us to talk more about it, Dr. Nancy Nielsen, Senior Associate Dean for Health Policy at UB's Medical School. Thanks for being with us.
Thank you, Kate.
So, Dr. Nielsen, let's start with that mask mandate that is now in place across the state. At this time last year, we were also wearing masks indoors. Hospitalizations did actually drop, we checked, in the 2 weeks before Thanksgiving. Wonder what you think about a measure like this and maybe what you would say to all the people out there who question if the mask mandates actually work. We know that masking does help slow the spread, right? But there are questions about the mandates. What are you telling people as they're having these discussions?
Well, I was telling people even before the mandate that do the smart thing, put a mask on, whether you're vaccinated or not, when you go indoors in a public place. So we frankly, if you were paying attention, you really didn't need the mandate to tell you that. But there's no question that once the mandate was announced, even over the weekend, as you mentioned, it just went in to effect today. But over the weekend, when I went grocery shopping and to church, everybody had on a mask. So, and that was a change. That was definitely a change. So it does work. We saw it last year. This year, we were seeing this tremendous rise in cases locally, 30% up from the week before. And that's a Thanksgiving surge. So I think the governor was very smart to do this and to extend it beyond the holiday gathering time.
Meanwhile, hospitalizations in Western New York are down over the past few days after reaching a near record high last week. Any cause for relief with that information, or does the busy holiday season mean that we're likely to remain in the high risk of transmission here?
Well, we for sure are going to be in the high risk of transmission, Kate. It's not quick enough we just can't see the response that quickly. Anybody who's going to be in the hospital is already infected. So wearing a mask is not going to help them at this point. So I think we're in for it with the hospitalizations for the next several weeks. But there's no question that wearing a mask makes a difference, and it will keep people out of the hospital and frankly, out of the funeral home.
Yeah, just yesterday we learned from the state the previous day, so this would have been Saturday, 8 deaths in Erie County alone, more than any other part of New York State for that single day. Dr. Nielsen, the big difference, a couple of them, between right now and this time last year. Of course, last year we didn't have vaccines or booster shots. Now we have both. We also now have this Omicron variant. We'll see how that's going to impact things. What concerns do you have as we head now into the winter months?
Well, the big concern is getting people vaccinated, primary vaccination, and then everybody who's been vaccinated clearly needs to get a booster. So I'm encouraging everybody to do that. We're very worried about this Omicron variant. If you heard what happened in the UK, it has just overwhelmed the UK, far outstripping the Delta variant. So if that happens here, we really do need to be concerned. Now, the good news potentially is that most of the cases seem to be mild, but the first death from the Omicron variant was reported today in the UK. We don't know how old that person is or if they had underlying problems. The point is we can't be complacent about this. So get vaccinated, get boosted, wear a mask, and for heaven's sake, enjoy your holidays. But please, if you're not vaccinated, stay home.
On that note of vaccination, wanted to ask you about that in regards to young people. As of yesterday, the state reports that 63% of New Yorkers between the ages of 12 and 17 are fully vaccinated, so that number continues to go up. As for 5 to 11-year-olds, just 11% in the state have completed a vaccine series. What would your message to parents of young children and those who say that most kids will be fine if they get COVID, what do you say to them?
I would say talk to the pediatricians because they will tell you the kids are not fine. This is not a mild disease. Luckily, most kids don't get real sick, but a number of them we have seen have had symptoms that lasted months. Nobody needs that. There have been about 700 deaths of children, but even those with mild disease, just like adults with mild or asymptomatic infection, they can have long COVID symptoms for months and months later. So please, parents, keep your kids safe. That's what everybody wants. You want them in school and you want them safe. Get them vaccinated, have them wear their masks, and let's stop fighting with one another because the real enemy is the virus.
We've been joined by Dr. Nancy Nielsen, Senior Associate Dean for Health Policy at UB's Medical School, among quite the resume. Dr. Nielsen, it's always great to see you. Thanks for coming on.
Thank you, Michael.